Well, despite all the talk about the end of the Affordable Care Act exchanges, one might paraphrase Mark Twain, reports of their death have been greatly exaggerated. That's because in the first week of open enrollment, Americans signing up for coverage, the number of them is very strong. Bertha Coombs has that story.
Obamacare is under fire in Washington, but that hasn't stopped some insurers. Against the odds, Oscar Health is expanding this year with a new plan in Ohio, co-branded with the legendary Cleveland Clinic.
Of the members we signed up in the past week, since beginning of open enrollments in Cleveland, already 25% have chosen their primary care physician through the Oscar mobile app.
All right, step forward.
Oscar and Cleveland Clinic are trying to be cautious.
We're not looking for this to be too big the first year. We want to work very closely with Oscar, market this appropriately.
But now they're bracing for bigger numbers after Anthem's exit from the Ohio exchange last summer. They expect to see strong demand from enrollees with chronic conditions attracted to the health center's reputation for high-quality care.
We expect that we're going to get some percentage of those lives coming over to our product.
President Trump's use of executive orders to undo parts of the Affordable Care Act, including cutting some subsidy payments, spooked insurers this summer. But the director of the Centers for Medicare and Medicaid, Seema Verma, says the administration is upholding the law, even as she disparaged it on a recent Cleveland Clinic visit.
We're making sure that people are aware of their choices and their options, but the reality is Obamacare is not working.
This summer's uncertainty led to high premium increases, which will hit hard for those who don't get tax credits. Yet demand has been strong in the first week of open enrollment. CMS says more than 600,000 people signed up in the first 4 days, up 79% from a year ago. And for people who receive subsidies, those higher prices for benchmark plans will result in bigger tax credits, and in some cases, lower costs.
The increase in the tax credit will be so much that it will completely cover the premium for the lowest cost bronze plan in the marketplace.
Well, a lot of insurers found their first year in the ACA individual market to be tough going. Cleveland Clinic expects its partnership to do better than break even in 2018, no matter what happens in Washington.
We have to drive quality and we have to make care more affordable. And those are no regret moves, and if we keep moving in that regardless of what happens in Washington, we'll be okay.
For Nightly Business Report, I'm Bertha Coombs.